So, this is the highlight of my year. I have just such an honor and privilege of talking to these amazing people, and I can tell you from the moment that the prizes were awarded until this very minute, I've been reading their papers, reading their articles, studying their work, talking with them, and really doing my best to get a feeling for them as individuals, and in addition to the reasons that they are honored tonight. And I think you're going to hear why I am just so honored and humbled to have a chance to speak with this amazing group of people. So I'm going to start with Emily, and as you saw in her video, she was a young girl who loved nature and thought she was going to be tracking baboons and dolphins, and ended up finding that field work wasn't all it was cracked up to be. So she kind of made a pivot in her career. So tell us a little bit more about that pivot.
Yeah, does it sound okay?
Yeah.
It happened for me in college. I wanted to be a field biologist, and we did a field study program in Costa Rica and Jamaica, and I was so excited, and we went out every day, and we picked these little projects, and we'd watch the leafcutter ants walk through the forest floor, and I found that I loved the first day of that, and the second day was okay, and if we had to do a third day, I just was really ready for the next thing. But what I really loved was sharing what we had found with the group, and it took me a few years to figure out that what that meant was I personally didn't have the attention span to do the meticulous work of science, which is so important, and I'm so glad that we have scientists who do that work, but I wanted to have the role of getting the results when they were finally done and sharing that with other people.
Well, you certainly have made that pivot, and it was UC Santa Cruz that you found had a science journalism program?
Yep.
Yeah, so did you get encouragement? And
yeah, it was, they just have 10 people every year who have a background in science and teach the skills of journalism, which I had never done. And as soon as the minute I got there, I just knew this was the career for me. I just loved it.
Well, we're lucky that you made that pivot, for sure. So Matthew, you and I have something in common. No, I am not a bone stem cell scientist, but I did grow up in a town of about 500 people. Did you in Kearney, Missouri? Is that right? Yeah. So, I don't think you had an intention of ending up doing what you're doing as a pathologist at a prestigious medical environment when you were a kid. But tell us how you ended up getting into medicine and getting, out of Missouri and into the position that you're in right now today.
I think I grew up as a kid with allergies and asthma, and just started to become curious about why this is happening to me, and picked up an immunology textbook from a used bookstore and started reading, and then one thing leads to another, and you've found a local college that had a research program and started interning there, and that set me on the path.
Got started, and so you studied NF-kappa B, and you studied T cells, I believe, for a while with your initial job. But you had a pivot too. So tell us about that pivot.
Right. So when I was an immunology graduate student, you read those classic papers from 20, 30 years ago, and you start daydreaming and thinking, if I was there 20 or 30 years ago, would I have been savvy enough to do this same pivotal work? And then that over time turns into, how can I do that type of work now? What's my time machine that lets me go back in time to do that type of fundamental work? And over time, the answer that I wound up is go to a field that was less well developed. That was the time machine. So for me, I moved from immunology, a really well-developed field, to bone, which is a much less well-developed field, and maybe had more opportunities to do fundamental work.
So there must have been some, professional risk involved in that. How did you negotiate the worry about that transition?
Well, the thing that really bridged and enabled that risk was actually getting a few key grants, like the NIH Director's Early Independence Award. And with that in hand, I said, I have a few years runway. I'm going to invest that runway into going in a new direction that really excites me.
Yeah, we'll come back and talk a little bit about today's students who are in the same situation and what they might be feeling about the security of making an important career change. So David, you grew up in Riverside, California. You went to a public school. But we had a wonderful conversation about your curiosity as a child. So I'd like you to tell the audience about the Q-tip experiment.
Oh, yeah, there's many aspects of my beginnings as a kid, really, interested in science that I think are shared by the other people on this stage. I also began my love of science just as a kid studying nature. I realized that I found it actually more fun after school every day to just go into my backyard and do experiments on plants and on insects, some of which would probably not be IRB approved, now that I think about it. But at the time, it was so exciting to me, and I would just spend hours and hours in the backyard. And because it was Southern California, things grow really well in the backyard. We had this area in the backyard that was supposed to be, in the most generic Southern California way, be turned into a pool, but for whatever reason, resources or fear, my parents never turned it into a pool. So it was literally just a pile of dirt. And in that pile grew the most amazing colonies of insects and plants. And so, one of the many questions I became interested in, just randomly studying insects and plants in my backyard, was how can an ant follow very precisely the trail of another ant that was no longer there? But because I spent hours watching them, I knew that the first ant walked this exact trail and the second ant followed that exact trail, even though the first ant was gone. And so I got some Q-tips and different liquids like water, cooking oil, rubbing alcohol, and I tried to pick up whatever the invisible substance was that was allowing one ant to follow the other ant. That was one of the gentler experiments I did on insects. But I think what you're hearing that probably all of us share is this: we had the good fortune of being in an environment where our curiosity could actually lead us, and we fell in love with that curiosity-driven passion for what would eventually become our careers.
So I'm going to fast forward a little bit, but high school, you entered a Westinghouse science competition studying neural networks of visual layering, I believe, but you won nationally. And
I came in second, actually. Just because the truth is important these days.
But as a consequence of that honor, you were invited to attend the Nobel Prize ceremony that year. I think that was 1990.
1990, so.
Yeah. And so you met E.J. Corey. Those of you in the audience who are chemists know that Professor Corey is renowned. I was a chemistry student, and I know about the Corey oxidation of this and the Corey alkylation of that. I mean, he's a very, very famous synthetic chemist. And so when you saw Dr. Corey get the Nobel Prize, what was your next step?
Well, it was amazing. I was a freshman at Harvard, attending the December 1990 Nobel Prize ceremony in Stockholm, and it's actually the first time I flew in an airplane by myself. I remember this because after I got back, my mom said she was proud of me that I only lost one sock. This is true. But I had the pleasure of seeing the man I now call EJ, Professor Corey, give his Nobel Prize lecture in chemistry, and I asked him a question about a synthesis. He described a synthesis of a molecule where he could react one carbon-carbon double bond, even though the molecule had several seemingly identical carbon-carbon double bonds, and I asked him how he knew that only this one would react. And he said, well, because I knew that it would fold into the shape that would protect the other ones, and I thought that was just the most amazing thing. And so I asked him the next natural question, which is, can I join your lab? And he was very kind. He said, well, maybe you should finished taking some organic chemistry first. So I finished one semester of organic chemistry, and then I showed up in his office and said, so I finished. Can I join your lab now? And he said, yes. And it was amazing. In retrospect, I realized how special that was. First, when I showed up in the lab, I was the only undergraduate there. He had just won the Nobel Prize in chemistry, and EJ was and still is considered to be one of the most skilled and prolific and creative builders of molecules, of drug-like molecules that the syntheses behind which have filled the pharmacopoeia of how we make drugs today.
Yeah.
So it was a very, it was really how I started my scientific
I
career.
think it's an amazing journey, and your temerity is admirable.
It's naivete, which is sometimes helpfully confused with temerity. But
So Matthew, let me come back to you for a second. One of the things that stuck in my mind when we were talking and you were exploring, well, first, make sure everyone in the room knows what a stem cell is. Can you just make sure everybody...
So stem cells, especially the type of stem cells we study, are the cells that make all the other cells in the organ. They live there your whole life, and they keep producing all the cells that do the job of that organ.
So you were studying these bone stem cells and were surprised to kind of work against some dogma. I mean, people thought all bone stem cells were the same, and you've discovered that there are at least 3 types. And that in and of itself, 3 consecutive amazing papers that really were groundbreaking. But you also challenged some other dogma. Certain cancers like breast and prostate cancer do tend to metastasize to the spine. And I was taught in medical school that if someone had prostate cancer, they should not valsalva. They should not strain in the bathroom. They should not bear down, because it would push those cancerous cells up into the spine, because it was believed that the blood flow is what determines. So tell us how you learned to challenge that dogma.
Right. So I think all of our significant discoveries really come from things where I was sitting in the lecture hall of medical school and go, that sounds weird. That doesn't really make sense. And I was taught the exact same thing that you were, right? And what a terrifying, ridiculous proposition for patients. Don't cough, because then you're going to create, your breast cancer will go to your spine. So exactly, all that came from work going back to 1940, looking at where the blood flow went, and only when people coughed or increased the pressure inside, there were puffs of blood flow that went into the spine. But the 99.9% of the blood flow didn't do that. So why is it that 99.9% doesn't count for where the cancer goes? So then we built on that and brought in our stem cell that formed the spine, and we think we now understand why breast and prostate cancer go to the spine way more often than other sites.
Yeah. It's fascinating. So Emily, you've been listening to these 2 people talk about their science and their journey, and you're a journalist, a science journalist. And what do you think about these stories?
I'm always fascinated by the science, but also the stories behind the science. And so when I call scientists and interview them, my first questions are usually not those details, but how did you even get interested in this in the first place? And those are often the most fun questions, because you get the backstory about the pool and the backyard and the ants. And, scientists become humans, which then I think helps readers relate to their work.
Yeah, it's, I'm sure if you were interviewing either of these 2 people, you would find it a fascinating journey, not particularly controversial. But we did talk a little bit about what happens when you are interviewing someone who has a belief or a really strong opinion about a certain scientific phenomenon, and then other people have violent disagreement with that person. I'm not even talking about crazy people. I'm just talking about 2 scientists who have very legitimate differences of opinion opinion and how they interpret science. So I think part of what amazes me so much about you is the process you go through to try to figure that out in your reporting. So share that, because it's something I think it relieved me to know there were reporters who do that.
Yeah, I mean, it's a process that I think readers never see. And the example we talked about was a recent story I did about a neuroscientist who studies this niche field of fluid flow through the brain. And it has implications for Alzheimer's and other brain diseases. And editor came to me and said, there's this very heated discussion happening in these online science forums where you don't usually have heated discussions happening. Can you look into it? You know, and of course I said yes, and started by reading the forums, reading these conversations, or reading the papers, and then I just reached out to everybody involved in this debate and argument. You know, will you talk to me? Sent out emails, phone calls, and they, you know, it was a very intense debate where these two groups, basically on two sides, were looking at the exact same data and the exact same images and coming to completely different interpretations about how fluid moves through the brain. And I thought, well, clearly I am gonna go figure out what the right answer is, and I'm gonna interview everyone and I'll figure it out. And it became clear that, you know, without a PhD in neuroscience, I was never gonna get to that. But what I did was I went to each person and said, I just really wanna hear your side, like, how did you get to your conclusions? And then I went to the other side and asked the same question. Very honest, open, and transparent goal of just understanding. How did you get from here to here when these people got from here to here? And after I did all that, I basically went back to each person and said, well, they're saying this. When you're saying this, like, what's the why? What's the explanation? Probably did that 5 or 6 different times, and then ended up with a draft that I sent to my editor, who then had his own questions, which started a whole new round of, well, what about this, and back and forth and back and forth. And I think in the end, you know, what you get is, for that story in particular, I didn't solve the controversy, and I didn't figure out what the right answer was, but I got at something deeper, which was that there's really different ideas about how we conduct science. And on one side, there was this woman who comes up with big, bold ideas and new names for structures in the brain, and thinks, well, you start big and then you chip away at that idea. And on the other side was a group that was saying, no, because now you're sending all these people down the wrong path. We need to go small, incremental, slow advances. And I didn't try to say which of those I thought was right. I just presented everybody's take and left it to the reader.
I think what's really important, or one of the important aspects of what you're getting at, is that people don't really understand the process of science. And, you know, and sometimes scientists themselves are responsible for that because they are very dogmatic. And yet, you know, there's controversy in everything in science, and it is an iterative, progressive learning and unlearning and relearning process. But, you know, for those of us who are kind of used to being in that world, we get it. But for a lot of people, it just seems like you see one scientist say one thing, another says another thing, and like, you don't know what to believe, so you throw your hands up in the air.
And I think science journalism is that same kind of process. And so by kind of just being transparent and being honest with your sources, but also with your readers, you're getting closer to, I think, an understanding and a trust for science in what that process is and what it leads to, and how we need to keep asking more questions.
Thank you for that. As I said, we're lucky we have journalists like you who are willing to go to that effort to really try to sort things out. I mentioned that Matthew had a kind of a pivot, you had a pivot. We haven't talked about your pivot, David, which was a situation where you were kind of on one path and you did good. you had a success, and then you made a switch, right? You went in a new and very high risk direction in your career.
So you're referring to the chemistry to biology switch. So yeah, as you might imagine, when I began my research career in E.J. Corey's lab, I was doing primarily organic chemistry. Although even then, E.J. was kind enough to let me work on the one sort of biological-ish project that he had, studying an enzyme called oxidosqualene cyclase, which is an amazing enzyme that takes this long, floppy hydrocarbon chain and in one reaction cyclizes it into that familiar 6,6,6,5 membered ring structure, the steroid, that is, of course, critical for all sorts of cell signaling and all sorts of corners of life. But even studying this enzyme, it was all done through synthetic organic chemistry, making small molecule analogs of the substrate and seeing if we fed them to the enzyme, what would come out? What would the enzyme do with them? But I began to realize that through courses, through seminars, through readings, that I was starting to become most curious just about living systems, about biology. And I think there's always a moment you have where you wonder if your advisor, your scientific hero, will disapprove of you not following in his or her footsteps, but instead going in a different direction. So as I began to reach graduation age in my undergraduate years, I think EJ sensed this worry because we had a meeting in his office, and he actually told me, before I was going to tell him, I actually am thinking of studying sort of what would now be called chemical biology in graduate school, not synthetic organic chemistry. Before I could even tell him that, he said, David, if I were in your shoes right now, I would study biology. And to hear that from EJ was, of course, deeply meaningful, but it also, in a broader sense, I think, exemplified mentorship, exemplified that our job as academics is not to clone ourselves. Our job is to connect our trainees with the best careers for them, no matter how different or similar they might be from our careers. And that's a lesson that I use all the time, every month. And I really credit EJ with, in this very vivid way, teaching me that that's what mentorship really looks like.
Now, you saw the video that described David's work and the editing of the genome, the DNA. I, as I said, did a lot of homework and trying to understand some of your more complicated papers, but I also watched some of your videos. And one of the things that just has stuck in my mind is, when you describe the first generation of CRISPR as cutting the DNA, just like a scissors. And then you say that base editing is like a pencil. You go in and just erase one of the bad base pairs and replace it right in the one that is supposed to be there. And prime editing is like a word processor. You go in and you take out a whole bunch of pieces of base pairs and you replace it with the proper gene. So that ability to translate some of the most complicated biochemistry that probably we've developed so far into such simple metaphors that everybody can understand the difference between a scissors and a word processor. But it speaks to, I think, why you have received so many teaching awards at Harvard. And, how come you're such a good teacher? When I think of chemists in my life, teaching wasn't really one of their core strengths. So how did that happen?
Oh boy, it's a tough question to answer, but I think whenever you make the choice to be an academic scientist, you are making a conscious decision that you have to love, and I think it's genuinely the best aspect of being a professor. You have to love the opportunity to work with and teach the most amazing, talented people at the peak of their life. You could define that as the peak of their creativity, or maybe the peak of their average immune system function, which I think is also a reasonable way to define when you're at the peak of your life. And to have this opportunity to train them is wonderful. You have to really love, I think, that aspect of it because it's such a unique aspect of this job. So, I think there is some self-selection, despite maybe what the experiences of your past chemistry teachers might have implied, that I think most people who spend their careers in academia really do love teaching. And I think we all appreciate that you can't really effectively teach somebody unless you can explain complicated concepts to them very concisely and very clearly. And then when you go outside of the ivory tower and you start to engage science journalists and then general journalists, you really have to walk a very fine line and find very rare solutions where you want to be always true and honest to the science, but you have to boil it down to the point where some non-scientist who will give you 5 seconds of their attention because they happen to pass over an NPR broadcast on their way to listening to their favorite radio station, which isn't NPR. You want to capture their attention so they don't move on. And that's where explaining concepts in the kind of boiled down way that you just described, I think is so important.
Matthew, I know, so you have been honored with the Physician Scientist Award, and many people would not necessarily get it that a pathologist was a physician scientist. But you also are a teacher, and you are responsible for a very important aspect of clinical medicine. It may not be exactly at the bedside, but it's very, very important to bedside medicine. I'd like you to kind of share that, because people might be wondering, well, you're in the lab, but what is your physician domain?
Right. So really, what is pathology, right?
Yeah.
So pathology is really the application of everything that we do in the research lab directly to patient care. That's what pathology is. In the research lab, we look at slides from mice. Pathology, you do the same thing from that patient and use that to give that patient a diagnosis. So pathology I think is really, really core to NIH and FNIH missions in that it's a direct application of science to the patient in front of you.
And you're teaching, correct? You have
Right, and I also teach. I teach the residents. I help to run the residency program, and like we just heard, I love it. That's one of the best parts of my job. And what's so fun about that is that it's the opportunity to really create culture. That when you see these trainees over and over, week after week, you can emphasize the same sort of things to them until it becomes a culture that moves beyond yourself, that they share with each other. This idea that there are certain things that if I kicked down your door and shined a flashlight in your eye in the middle of the night, you'd be able to tell me, what this antigen is that's causing this blood reaction or that, right? These really important stuff I want everyone to know. And you emphasize to that people and over enough, and it starts to become like an in-joke in the program among the residents. And that's kind of fun to see that take a life of its own.
Thank you for that. We are serious about the science here, and both of you are, masters of your science. I'll ask both of you, where do you think this is going to lead you in 5 years or so? For example, David, the space editing, prime editing, where do you see the implication of this work might be?
Yeah, so we continue to advance editing technologies, and I think the critical companion of editing technologies is in vivo delivery technologies. So our lab and many others are working on those problems, but increasingly a frontier that I'm working on and spending a lot more of my time than I would have anticipated is how to connect the science with patients, given that the vast majority of the 400 million or so people in this world with genetic disease have diseases too rare for a company to be able to, in a financially responsible way, go after the disease. It's not something I think we can blame companies for. It does no good if companies that develop medicines go out of business because they chose to pursue diseases that don't offer them the opportunity to return on their investment. But it is increasingly urgent, I think, as we have now methods to correct the mutations that cause the vast majority of genetic diseases, to somehow connect the science with patients better, because in many cases, not all cases, but in many cases, the bottleneck is no longer the science, as demonstrated by baby KJ Muldoon's incredible sub-7-month diagnosis to base editing treatment of a mutation that had never been seen before in CPS1 to rescue that baby's life. So in many cases, it's not the science, it's the system. It's the system that's the bottleneck. So recently, very recently, together with colleagues Winston Yan and Tim Yu, who developed Milicin, that first N of 1 drug, the antisense oligonucleotide, Anna Greca, we've just started a Center for Genetic Surgery, CGS. The goal of CGS, it's nonprofit, is to make genetic surgery, very carefully named, Center for Genetic Surgery, that is precision gene editing, as routine as interventional surgery. Because doctors can do life or death experimental heart surgery on a baby, and as long as the need is great and the risk benefit is favorable, they just need IRB approval. They don't go to FDA for a new IND application that could take years. We want, and we feel like in some cases, the science is now robust enough and the delivery and the manufacturing is robust enough that in some cases, we should be able to make genetic surgery that routine as interventional surgery.
In 5 years?
Within 5 years, oh yes, yeah, in that time scale. So that's really what's occupying a lot of my time as sort of a side job now, but it's become a real passion because, again, the vast majority of these patients need a mechanism like that in order to benefit from this science. And it's very frustrating that every day I get on average about 3 or maybe 4 emails from patient families that say, here's the genetic diagnosis of my son or my daughter or my husband or my brother. Can you correct the mutation? And when base editing first came out, the answer 90% of the time was it's not really a good mutation that we can correct with base editing. And then it became maybe half of those. And then after prime editing, it's pretty much always, the good news is there is a way to correct this mutation. The bad news is it will take $10 million and many years, and the development of cell and animal models and regulatory streamlining for your son or daughter to have a realistic chance to benefit from the fact that we know how to correct this mutation. So that's what CGS is going to try to do, to shorten that time frame, to do so in a really scalable, sustainable way, and specifically to treat diseases that are too rare to be taken on by industry.
That's a very, very hopeful outlook. Thank you. Not so hopeful, Matthew, is your experience in the pipeline of people working in your lab, the pipeline of young scientists coming through the system. And we talked a little bit about the before and the after and some of your worries about your workforce. So you just kind of expound on that a little bit, because I think that many people in this room share that same concern.
Sure. So I mean, it's a difficult time for us mid-career senior scientists, but it's an even more difficult time for the junior people, especially the people entering career pivot points. We had 2 postdoctoral fellows, very strong, that had done our core studies that had job offers that were basically, yanked away recently. And I do worry about the graduate students that then sit and look at that happening to those postdocs and say, is this what's in my future? Is this the way things are now? I don't have easy answers to those things, but the best thing that I can do, I think, is to provide a place where those people can, continue their work, have a little bit of breathing space until they get to the next step, and try as best I can to instill the idea that as long as you do excellent work, in some way, in some fashion, you will find a home and you ultimately will be successful as long as your work is high quality.
Well, we're very close to being at our time, so I wish we could keep talking for a bit longer, but I do want to let Emily have the last word here, because at the end of the day, trust is the most important thing. trust in the promise of what you're doing, trust in people's ability to enter the field of science and continue this wonderful pipeline of talent and curiosity and innovation that our country is so good at and so proud of. But trust is, as we all know, at a low point, and you're part of the solution to that. So I would like, maybe you can give us something hopeful on how we're going to, really turn this around.
I mean, for all that you said, that's true. I think there's still a lot of scientists doing really great work, and I'm struck on a daily basis by every scientist I speak to and how much they care about their work and how much good work they're doing and how committed they are to it. And I think there's also a lot of journalists who are, out there reporting on what's happening. At the end of the day, I see scientists and science journalists as collaborators in a much bigger goal of getting information out into the world and building that kind of trust. And I think not giving up just because things are challenging is really the, how I.
Well, and I do, you are a teacher also. You teach scientists how to be better communicators, how to be the translate their science into things that are more approachable to people who are not scientists. So, as I said, I wish we could spend another hour talking. We cannot, but I'm so grateful that you would even be here to have this chat, and I am absolutely humbled and honored to participate in it, but also congratulate all three of you for just incredible contributions, but also for sharing your experience with this audience. It's a great gift to all of us. So thank you and congratulations.
Thank you.
Thank you. You need to say something. So you could just wait here. I'm just closing us out here, and as you can see, there is no longer a teleprompter here, so this is really going to be impromptu. No, it's been a lovely evening. I'm incredibly grateful for the audience. I am also incredibly grateful to my board, my colleagues, and all of the people who've been supporting us, not just financially supporting us, which means everything. As I said at the beginning of the evening, this dinner is not about having a nice dinner. This dinner is about the resources that we use to try to build our partnerships, accelerate our ability to get things started and moving. And the resources that we raise here are precious to FNIH. So thank you, thank you, thank you for that. And just thank you for having a moment of celebration of science and the scientists and communicators of science that are really, at the end of the day, the way we translate curiosity into things that at the bedside really make a difference. So have a good evening. Thank you. See you next year. Thank you.